I just want to start by thanking everyone for attending today's webinar to celebrate National Foster Care Month with Boston Children's Hospital, the Wonder Fund, and the Department of Children and Families. We are so excited to welcome our speakers today as we acknowledge and recognize the important role of foster parents and the hard work that goes into foster care at this event today. My name is Shannon Moore. I am the Director of State Government Relations at Boston Children's Hospital, and I will be moderating today's briefing. We have a really packed agenda today, so I just want to go over some housekeeping items before we start. We will hear today from presenters from Boston Children's Hospital, the Wonder Fund, and the State Department of Children and Families, and then hear a presentation from families who have firsthand experience with fostering. At the end of the presentations, for folks on the call who are either already fostering parents looking for additional resources or who are attending today as potential foster parents, we will be breaking out into small groups for you to speak directly with staff on this call about the next steps on your fostering journey. And I know a lot of people are already familiar with Zoom features at this point, but I want to ask that participants either use the chat function if they have questions, and we can respond to any questions live or follow up after. As I asked our speaker panel, they will be on mute with their cameras off when they are not speaking, but otherwise we are ready to get started. So again, I'm going to thank our speakers and participants for coming today. And with that, I am going to turn this over for some remarks from Boston Children's Hospital President and Chief Executive Officer, Dr. Kevin Churchwell. Dr. Churchwell.
Thank you so much, Shannon. And I just want to thank everybody for taking the time. You know, I know these are challenging times for everyone, but to take the opportunity that you're taking to look and us to talk about the importance of this work and the importance of celebrating our foster parents, I just want to thank everyone for participating. You know, I also want to just celebrate our partnership between Boston Children's Hospital and the Department of Children and Families and Wonder Fund, and the dedication that we all have on fostering and supporting our foster parents. You know, the role of Boston Children's Hospital in fostering is important. We at BCH, we frequently have kids at Boston Children's who are in need of foster care with some level of medical need. Boston Children's, our staff works closely with DCF to support foster parents in managing our children's medical needs. We also help to match our patients, our children with medical needs, to appropriate care, to the relatives, to assist with managing the medical condition. So we're so proud and happy to help with these efforts and to work with our colleagues at the Department of Children and Families and Wonder Fund. So next, I would like to introduce our First Lady, Lauren Baker, who will be speaking today on behalf of the Wonder Fund. First Lady.
Good morning, everybody, and thank you so much for inviting me. I am just thrilled and honored to be here. And I first want to start by thanking Children's Hospital and for all the work that you have done to continue to serve all kids, well, for your entire history, but especially during this last challenging year and a half. Children's Hospital is world renowned for good reason, for keeping all of our children healthy and safe and well adjusted. And DCF is a great partner for them. And today I want to especially thank all of you for coming to celebrate the work of foster parents and the importance and the gift that foster parents are to these children who need them. In Massachusetts, we have about 50,000 kids who are associated and involved with the Department of Children and Families. And these kids, through no fault of their own, have really endured some pretty tough stuff. And in the cases where foster parents can get involved, that is just pure magic. And I really want to thank all of you for considering being foster parents and to DCF for working to support the foster parents. You know, foster care is, foster parents are really saints among us. You open your home and your heart to a child who really needs it. And you can quite literally, just by loving that child and giving them a safe and supportive place to live, you can change the trajectory of their lives and change the world forever. And that is really just an unbelievable gift, not only to the child, but to the Commonwealth of Massachusetts and future generations, because you really make a difference. And all of us here want to support people interested in becoming foster families in whatever way we can. And you'll learn a lot more about DCF and the Wonder Fund and what we all do to support you in a little while. But the Wonder Fund is my personal initiative, and we are here for foster families in any way that we are needed. And we work every day to support any child engaged with DCF with resources and opportunities to have those moments of childhood wonder that every child deserves. And foster parents play a very big role in making that kind of magic happen for kids every day. So thank you. Thank you to Children's Hospital. Thank you to DCF for the amazing work that you do every day. And thank you to foster parents for making wonderful things happen for kids. And now I'm going to toss it over to our DCF Assistant Commissioner, Stavern Miller. Thanks.
Thank you, First Lady. Good morning. I'm happy to be with you all today. As was stated, I'm the Assistant Commissioner responsible for foster care and adoption. I'm so excited for this opportunity to speak to you all because personally, I am a child of parents who fostered for over 40 years for the department. So I know how important this work is. So it is really an honor for me to be responsible for ensuring that the work that we do is the best for the children and for the foster and adoptive families that we work with. Today, you know, child welfare is a partnership, and we depend deeply on our multiple partners like foster parents, medical professionals, in order to keep our children safe. So I want to thank you, the current foster parents, for being so dedicated to the children, especially during these uncertain times, and helping us through this public health crisis that we went through this last year. And even with that challenge, we've been able to continue to recruit foster parents, which is such an accomplishment. We can never have enough foster parents. We're always looking for people from diverse backgrounds so that we can place children in the community where they feel most comfortable, where people have a true understanding of who they are and can get them through this process with the different needs that they may have. We at the department value our foster parents, and we could not do the work that we do without you all. The best way for us to do that is to have stable homes for kids so that they can begin the healing process from the trauma that they've experienced. So a special thank you to Children's Hospital for the partnership that we have, whether it's the foster the clinic where our foster children can come to, or it's this opportunity where you're helping us with this recruitment effort to bring on great families to foster and adopt the children of the Commonwealth. So thank you for this opportunity, and thank you for considering becoming a foster parent or an adoptive parent for the children of the Commonwealth. And right now, I would like to introduce my colleague, who is the recruitment supervisor, Lori Gerd-Harry, and following her will be a speaker from the Wonder Fund, Jenny Nardone. Thank you.
Thank you so much, Stavern, and thank you, everyone. My name is Lori, and I am a foster parent recruiter, and I work with a group of wonderful foster parent recruiters throughout the state. And our goal is to find foster parents who are as dedicated as we are to ensuring the safety and nurturing of children in the care of the department. first and foremost, just thank you to every foster parent in the room today. You are our backbone, and we are eternally grateful for you. I always like to tell foster parents, you know, you're my superheroes. And they look at me and they always say, Lori, you know, we're just regular people. And I say to them that they are regular people doing extraordinary things. And I just, from our heart, we cannot thank you anymore. We are so grateful for all the work that you do and the love that you put into this work. So I hope that everyone here can attend our breakout sessions. We are going to talk more about how you can become a foster parent, how you can help. There is something that each one of us can do to help ensure that our foster children are provided with the opportunity to grow and flourish. So with that being said, I'm going to pass it over to CEO of the Wonder Fund, Erin Rafferty, for some more words. Thank you all.
Thank you so much, Lori. I'm starting my video. Thank you so much, Lori, for that great introduction. And thank you to Children's Hospital and everybody who's spoken so far, describing how grateful we are to the amazing foster parents who do incredible work with the most vulnerable population on the planet. We are in awe of you. And as the CEO of the Wonder Fund, I have the great honor of running an organization that is specifically dedicated to supporting foster parents, supporting children involved with the Department of Children and Families who are in foster care, as well as at home receiving services from DCF. But we really want to focus on what the Wonder Fund can do for you all, for your families who are supporting these very special children and all of their unique challenges on a day-to-day basis. And I wanted to first of all say that you know, as a person, just personally, when I think of who my heroes are, they always are foster parents. So I have a personal, just, you know, sense of gratitude and awe to all of you for what you do. And it's just such an honor to work for an organization that thinks of ways every single day, new ways we can be supporting the work that you do. So let me just tell you a little bit about what the Wonder Fund does and invite you to access all of the resources we would love to provide to you all. We're a private 501c3 nonprofit organization that works very closely with DCF, but is independent of DCF, but works very closely with DCF to make sure that we can provide care and support to children involved with DCF in two primary ways. One is through enrichment, enriching the lives of children who've been impacted by trauma. And the other is through what we call emergency aid. So emergency resources and items for children who are being removed or have been removed from their home for their own safety and placed into foster homes like yours. And a little bit about enrichment first. We provide, the Wonder Fund provides what we call grants, but basically we will fund an enrichment opportunity for any child involved with the Department of Children and Families with an open case with DCF, including foster children, whether they want to take dance lessons, play sports, take driver's ed, SAT prep, go to summer camp. We are here for it. We love that. We believe that enrichment opportunities build confidence, help children establish great relationships with peers and safe adults, teach children new skills, and also get children sort of out of their usual routine and their minds engaged in something positive and strong and healthy. So enrichment. So if you have children that you are fostering who are interested in playing a sport or taking an art class, anything that they are interested in, it doesn't have to fit into, you know, we don't have to fit square pegs into round holes. If a child's, you know, into martial arts or a child you know, wants to get certified as a swimming instructor so they can have a summer job this summer, we would love to support that endeavor. So the primary way you can make sure we give you that support is by talking to your social worker, your family resource worker about accessing Wonder Fund funds. It's a pretty simple process. And we try to turn those requests around in a matter of days. So please don't feel like you have to restrict what the child wants to do, or restrict because of funding or budget, because we understand this stuff can be very expensive. That's what we are here for. This is why we raise money from private citizens and corporations. We don't take any state or government money. We raise money so that kids can be able to, can have access to these fantastic opportunities that every child deserves. So that's enrichment. The other key area where we focus is on emergency services, so emergency aid. So when a child is removed from their home, often, as many of you know, they're coming with either nothing, or the clothes on their backs, or maybe a trash bag, or historically, hopefully not anymore, a small, sort of plastic bag of their items that they could grab in the moment. And what the Wonder Fund is here to do is to provide a little extra support and care and dignity in an otherwise very traumatic situation. So we have the ability to provide every child coming out of their home and placed into foster care with a modest gift card that the foster family can use to purchase culturally appropriate or familiar food, clothes for school the next day, whatever that child needs to feel a little bit more comfortable and safe in that very traumatic moment in the first 24 to 48 hours. We provide a $50 gift card to help foster parents kind of get the child on their way and situated. And we also work really hard to outfit every area office throughout the state with clothes, new clothes, and duffel bags, and socks and underwear and pajamas, so that the child can have something of their own when they're being placed into foster care that's new and that's that feels like theirs, and make sure that they have what they need for, like I said, for the first 48 hours in care. So those are sort of our two primary ways we serve children involved with DCF. And I want to just talk a little bit about more, and I'm sort of under the enrichment bucket, because we have a lot of exciting opportunities for foster families to take advantage of. And one of those is through the Wonder Fund Access Card. Every foster family is entitled to a Wonder Fund Access Card, which identifies you as a foster family in Massachusetts, which, by the way, you should have t-shirts with the Superman sign, the Superwoman sign that says foster family, because everybody should know the incredible work that you do. But this little Wonder Fund card, it's a little orange card that you can go on our website and look at who our Wonder Fund Access partners are. And there are several organizations that give foster families either free or discounted access to their facilities, including the Children's Museum in Boston, including the Basketball Hall of Fame out in Western Mass, including the Patriots Hall of Fame down in Foxborough, the Zoo New England in Boston and in Stoneham, and many other partners throughout the state who will accept the Wonder Fund Access Card that you are entitled to have. So ask your social worker or family resource worker, if you don't already have one, to free and discounted opportunities. And those opportunities are being added by my colleague, Jenny Nardone, on a daily basis. So consistently check back on our website to see what other kinds of opportunities are available to you as foster parents, because we love, this is the business we're in, opening up doors so that you can bring your whole families, including your foster children, but if you have biological children as well, your whole families to experience what every family deserves to be able to experience with partners throughout the state. In addition, we have a great relationship with the Museum of Science, who is one of our first partners. They don't necessarily even need the access card, but if you are a foster family in Massachusetts, you are entitled to access the Museum of Science and all that they have, their exhibits, their rotating shows. They are very, very excited to welcome any foster family in Massachusetts into their facility. And they're actually migrating over to use the access card too, but you don't even need that right now. You can just go up to the Museum of Science and access what they have to offer, which is really pretty incredible. We partner with an organization called Good Sports, who makes sure that every single child in foster care in Massachusetts has sports equipment if they want to play sports, if they want to play Little League or basketball, they will make sure they have their bat and their glove and their basketball and whatever other sports equipment they need through the Wonder Fund. So that should never be an issue. And we also have a exclusive partnership with the YMCA throughout Massachusetts, so that every foster family in Massachusetts is entitled to a free membership to their local Y, independent of where they live throughout the state. So this is what we are in the business of doing, figuring out opportunities for foster families for children that they love and care for in their own homes. We are accessible. You can always look on our website and contact us directly, but the primary way to access our resources is through your social worker, your family resource worker. We are here. We are in awe of you, and we truly live to serve you. We exist to serve you, so please use us. And with that, I would like to introduce somebody very special, Nick D'Onofrio. Nicholas and Julia D'Onofrio have been married for 14 years. Nicholas has been part of the Boston Children's staff for the last 13 years, and Julia is an educator working as a professor at the undergraduate level. Together, they have 2 biological sons who are 10 and 8. 4 years ago, the family decided to open up their home to children to short-term placements through DCF. After a number of respite placements, they received a long-term placement that will culminate in adoption in June of this year. In the summer of 2020, the full biological sister of their pre-adoptive daughter came home. Nicholas and Julia are committed to working through the DCF education and healthcare systems to support the needs of children, especially those who are underserved. Please welcome Nicholas D'Onofrio.
Erin, thank you so much for the introduction. By the way, I do have my Wonder Fund card. I received that not long ago, and we've been able to use it. So thank you for all the work you do. Let me actually share with you my screen right now. And I want to also bring into the conversation if two other families right now. And let me see if I can do that. And they really are friends to us, and I'm going to be sharing that screen right now, and I'm going to be introducing them. Let's see where we are with that presentation. You know, let me actually, technology is sometimes not my friend. Let me actually tell you a little bit about them. Suzanne and Michael van der Wissen are a foster family as well. You know, they've been licensed with DCF since 2015. Michael originally immigrated from the Netherlands, and Suzanne got married, and Michael got married in 2011. He works in the Marine Zone field. Suzanne is a pediatric nurse who has worked at Boston Children's and 10 Northwest and 10 East, and also in the ortho clinic. Suzanne's heart for children foster care was born in part from her work with at-risk children, both at work and professionally in her personal life. Since 2015, Michael and Suzanne have adopted 3 wonderful kids who also happens to be siblings. They initially came into DCF care and into their home as unrestricted foster care placements, but then went on to be adopted. They volunteer with the Fostering Hope Merrimack Valley, and Suzanne sits on the Behavioral DCF board. We have with us Fran and Pam Newcomb. They've been foster parents in the last 11 years or so. They have 3 adult children and 2 grandchildren. Their first grandchildren was actually also adopted by the oldest biological son of them. So Fred and Pam also work full-time in their family business. For the last 11 years, they've been receiving newborns, respite, and hotline home through their home has passed more than 100 kids, and now they're focusing more on the teen side of things, if you will. Fred is also a MAP trainer, and we're going to be hearing more about that. So with further ado, let me actually shut off my camera right now. Let's bring, by the magic of Zoom, let me bring them into this conversation. And again, I'm privileged and very humbled to be here with you today. Let me bring also Julia, my wonderful wife. And here we are. You know, this is probably the first time that we are actually gathering together with the Van der Wissens and the Newcombs and us, Julia. And the goal here is to really share with the audience as we celebrate Foster Care Month here in the Commonwealth of Massachusetts, our experiences in navigating the DCF system. What is it? How does it look like to be, in some ways, co-parenting with the state, and really creating awareness in terms of respite care, foster care, and Pam and Fred, Michael, Suzanne, and Julia, we also have experienced all this journey in so many different ways. But what we should say, Pam, let's start with you. What we should say in terms of your exposure with hosting. I mean, we kind of see your grandchild in the back, but so you are a grandparent, is that right? And then you also are hosting respite placements, as DCF call them, or do you also are currently with any foster children?
Well, right now, yeah, we have 3 adult children, and we are watching our grandchild right now. And we've been doing foster care for 12 years. Throughout that time, we've had many different roles, starting with infants, hotline, and then most currently, we've been working with teens. And right now, we don't have a teen in our home, but we are a visiting resource for a teen who's working to transition to our home from a group home setting.
What do you mean with that?
Well, in this case, just a couple different things. Does your home meet physical standards to house a child for the state, if you will, is really the big thing. And hopefully, as foster parents, we meet some minimal, at least, like a Corey check, so that we are safe people to be entrusted with a child. So minimally that, and certainly now it's over 12 years ago, but we went through 30 hours of training specifically to become a foster family.
In that training, the foster care training, I mean, we have gone through, it's called MAP, and that is the same training that you will get if you're a respite family, if you are foster in adoption family. Is that right?
Right.
Yeah.
Correct. Yep.
So have you done more respite care, or have you done? Don't worry, you do whatever. This is live TV.
Fred's gonna get
This
the
is
baby.
live
This
TV. No
is
worries
real
about
live.
no worries. No worries. Okay. And this is your grandchild, so this is your own kid. So don't worry about it. But do you have right now? So you are helping one of your kids with your grandchild. So how does those dynamics? And this is the beauty of it. This is live. This cannot get any more real. You're right there with your own child. So do you have, where are you right now? Are you open for any respite?
Yes, actually right now we're open. We are an open home. We've been on hold a little while we're waiting to find out if this teen that we're a visiting resource for is going to actually make the transition to our home. But we will be open to take another teen. We have plans in June to actually do a 10-day respite for a 17-year-old who's with another home. So in the foster care community, we help each other out. And there's a lot of different ways to be involved. Right. So what it means to be an open home is that we're waiting for, a child that would be a good match for our home. It's important when you welcome a child into your home that it fits for your family, because it's important that when they come, we want the kids to be able to stay until they're safely reunified with their family. So you never know when you're going to get the call. We could get a call by the end of today saying we have a child that we'd like to place in your home, and when they call, that child shows up that day.
I'm sure it's very complex too, in terms of the dynamics and setting up your family for a new little kiddo that is coming to your family, or older. You may have also a teenager. That's right. But so maybe let's bring Suzanne and your experience, and Julia too. In terms of there's so much need out there, and I'm sure Suzanne, you as a nurse and also be someone that has worked in the inpatient side of Boston Children's Hospital, I'm sure you have seen so much in terms of the patients that come to Boston Children's that are DCF kids, and then your personal life that you have actually you and Michael have opened your home to DCF to be a home for kids that are in need. How has that been, that experience for you, seeing a professional and in your home life?
Yeah, I've always known, right, that I wanted to work with children. I've always had a heart for children, and so going into the nursing profession, there was no question. And I'll say tongue in cheek frequently, I don't know why you'd be a nurse to not be a pediatric nurse. That just dumbfounds me that somebody would want to do something other than pediatrics. And so I found a home, oh my goodness, years ago on 10 Northwest First, just a couple years out of nursing school, and very quickly realized both the demographic, I think, in Boston and the surrounding area, and the kids that I intersected with were different than what I had experienced just even 11 miles north of the city in the suburbs. And I became more and more acquainted with DCF. The floor I was first working on frequently saw traumas, broken bones, different reasons why kids might, be called into, questionable situations. And so the social workers frequently, a lot of us had big hearts for these kids, and of course our hearts broke for children who were on our assignments as a result of suffering. And so we would joke like, oh, I would take this little guy home in a minute. I would take this baby. And the social workers from DCF will be like, well, we have a way that we can make that happen. And it was like, oh, okay. And so I also worked a little bit on 10 East. That was, any nurses from 10 East or staff from over there knows that's a slightly different population, infants and toddlers. And they usually came into care or came under DCF's umbrella in slightly different ways situationally. And so I had some friends and family who had fostered, and I do believe the seeds first, though, were planted back on 10 Northwest and back on 10 East. And so as my husband and I, who wishes he could be here, talked more, we really felt like foster care and potentially adoption was a way that we would open our home to kids. And so years ago, we did just that. And our experience was really, really positive. I wish for anyone entering foster care, they could have had the first experience we had with a baby who was in our care for 6 months and reunited with a mom who was healthy and wonderful, and we're still in touch 5 years later. And I think it was so much of just personally and professionally getting to know families, getting to know kids, getting to know DCF and the social workers and how hard they work, and the depths of their job, and what they're doing, frequently sitting at the bedside of kids for hours, in a hospital. And so for us, over the last 5 or so years, that resulted in adopting a sibling set of a few children. We've done respite here and there. And we've got a 25-year-old guy that we mentor, and we are currently not an open foster home per se, but once the dust settles a little bit with our 4 kids, we'll likely open back up.
So that's right, because you have one biological, and then you have 3 that now they're fully adopted. Is that right?
Fully adopted. Yep. 3 little kids, and they actually have a 4th sibling who, friends of ours were also becoming licensed around the time that she was born, and they lovingly brought her into their home as a foster care placement and adopted her recently too. So we've got a very big, loud, unique dynamic for our family, and we love it. we love it, able to have all the kids together and see each other frequently.
What you're saying about, you know, your experience working and being part of the Boston Children's staff and the nurses and social workers and the caseworkers on the DCF side, we should say, Julia, that this partnership, you know, there's so much about caring and so much that, yeah, for many of these individuals, that's their job, but it goes beyond being their job. You know, we should share with us a little bit about our experience working with these caseworkers and helping us, you know, as you have different children, you know, you may have different caseworkers too. So there is it's a big team. At times, you know, when you especially have more than one kid at your house. How's it for you, Julia, co-parenting with the state? And I'm sure, hey, I'm sure, you know, it's like a team, you know, you have up and downs because again, there's a lot of doctor's appointment. Suzanne, you've seen it go sometimes, in how many of these kids, they do need a little extra care. So what's your take?
I mean, we've been so blessed with the workers we've had. They're amazing, and they have supported us in so many ways, and it's been so wonderful. I mean, now I think it's coming up on starting the 5th year that we've been doing respite, and now almost into adoption with our first daughter. So but we've had the same family resource worker that whole time, and so to have the relationship with her that we get to have conversations often, I mean, definitely monthly, but often, about what's going on, and then have her follow our family in many ways is really wonderful. And so when our second foster daughter came, which is the full biological sister of our almost adoptive daughter, it was like, you know, the caseworker brought her to our home, and it was like an amazing experience for all of us, but also her, like, she was like, I got to be there when the sisters met. And so it's like, they're part of your family in some senses, knowing the ins and outs of your kids. And so that's been really wonderful to have, you know, the workers alongside us, and loving our kids as well. So we've been really fortunate to have amazing workers working alongside us and helping us think through resources for each of them, and different programs that we can work with to meet their needs. So that's been really, really helpful.
Yeah. And for many of our audience and even us, you know, there's so many out there that they may be doing this and feeling overwhelmed and not knowing many times how to navigate the system, and that's the spirit of really coming together today and be able to hear from others and knowing that there is a law out there that is really built to help families like ours.
Yeah, I think with that, I'll say, like, I mean, there's all the social workers that are so helpful, but even this group, I mean, we you know, the Newcombs were some of the first people that we saw fostering when we first got married. I mean, think about that seed that was planted for us. And then Suzanne as well, I, you know, met her when she first started fostering. And so, I mean, then you build these relationships because you feel like, yes, we all are moving forward in these unknown and uncharted waters, but also moving forward to love these children. And so as we've gotten further into our journey, there's more and more people we're getting to know that are doing the same thing. And we're also getting more and more people, and like Suzanne was talking about their friends that took the 4th sibling, there's more and more people that were like, okay, we need you to get involved. And so it's wonderful to also have other families, not just, you know, DCF, but other families as well that are in the system.
Nick, if I could, I think for me, and this is just what we're talking about, but the sense or the definition of community gets changed so much. I mean, the people that we interact, as well as the family and the children that we take, are all from our own community. They're either in our towns or surrounding towns. And before we started this, I had absolutely no idea about the need.
Mm.
Yeah, that they're literally our neighbors. We're on the North Shore, and who knew? In our town, we've gotten called for emergency care, you know. I think that was really eye-opening. And the other organizations outside of DCF that offer support by providing football and music lessons and summer camps. And, you know, the goal is for these kids to be able to have the same experience as your own kids. And between DCF and outside agencies and our neighbors and our friends and our networks, it's really pretty amazing to see just how big that community is.
Yeah.
As we wrap up this portion, what would you say, you know, maybe a 20-second, 30-second comment to maybe an individual that is thinking to open their home, but they may think like, you know what, Pam and Fred and Suzanne and Nick and Julia, all these people, they have it all put together. And by the way, the reasons are things they do have it all put together. And the newcomers, they don't know if it's, we don't have it all put together.
I was going to say the D'Onofrios do, the Newcombs don't, but that's okay.
I'm just saying, but what would you say? Let's say, let's think about, you know, again, that may be, you know, again, you know, you're working full time. Some people might even be working 2 jobs, and then they do have that thing in their heart that they do want to open up their homes. Suzanne, what would you say maybe to a nurse, to somebody that is in the medical field, that they're very familiar with things that are coming left or right through a hospital, that for a healthcare professional it may be very like they're more exposed, but they're not really sure to maybe move forward, opening their home, maybe to respite care or foster care?
Yeah, I feel like it's an advantage to know a little bit about how kids come into care and what kids face. And I think if you're working in the fields, you're already 80% of the way there, just with a passion for helping kids. And I'll just say it's an out of the box approach to parenting in a lot of really great ways. It's similar in so many ways. You know, we've done info session, and one of Pam's you know, famous lines is, when you open the door, you know, we have all of these ideas of what foster kids are like or what they come with, and it's usually a tired and hungry kid who's maybe showing up in the middle of the night, or you're taking home from work if a social worker does manage to get you to be a person. But I just think, you know, it's a lifestyle that has become a very organic way to take care of our neighbors, to take care of families who are in need. You start realizing the depths of just humanity and the highs and the lows. And it really is a type of frontline work that you can do in your own home and around your own table. And the state has always worked hard to work with us, to bring car seats. I had my social worker brought me a dinner when my husband was out of town once. I mean, they really do what they can with their resources to work with you for the best of, you know, for what's best for the kids. And so it has really become a wonderful part of our life, and of course our family forever. But you're closer than you think. You really are closer than you think. It is not the leap that even I mentally had thinking about doing foster care.
Nice. Thank you, Suzanne. Pam and Fred?
I guess I would just say it's an adventure like no other. I mean, Pam and I talked about it though. I mean, we were approaching becoming empty nesters, and I don't know, maybe it was a lack of foresight on our part, but we didn't have a bucket list of things that we felt like we needed to accomplish, or else we had already accomplished it and didn't realize it. But I would say the last 10 years have been, 12 years have been an adventure that I would not,
better than any bucket list.
Right, and just such an a blessing in so many ways and a joy, even when the times were really frustrating. I don't know how you can't characterize it except to live it and say, you know, you should do it because it is all of that. You know, it's never dull.
No.
And I two things I'd like to just add to that is please don't do it if you think you have it all together, because that idea will get blown right up. But I think the one thing that we hear a lot is, aren't you afraid you're going to get attached? And, you know, I've thought on that. And actually, it was my youngest daughter who said, why is that a bad thing? And it's like, attachments are good.
Yeah.
And so don't do it for fear of that. And the other piece that I think is really important is to realize that as a foster parent, you have the privilege to stand in the gap with a child who's in an in-between stage of their life. And the reason kids come into foster care is that families can heal and be reunited. That is the goal of the department, is to reunite families. And I think there's no greater privilege than to stand in a gap with a child during that time and give them a place of healing. And pretty much you open your home, they become a part of your family, and you all scoop and move. So, you know, I think that if this is on your heart and you're watching this video, I would say go the next step.
Yeah.
Go to the next step.
Yeah.
Jules, last 20 seconds.
Actually, I would say the same thing. Take the first, take that first step, because when we started, our boys were young and we were thinking, how are they going to handle this? And we started with taking MAP and then doing respite, which was weekends and nights. And we were amazed at how well the boys opened their hearts and our home and felt like, yes, this is what we should be doing. And then we're adopting. So I think just take that first step. You can always then decide no, but take the first step and take the class, get more information, and you probably will keep going.
Go the next step. I guess that's the tagline right here. And we thank the Van der Wissens and the Newcombs, and thank you, Jules, for being right here, and for being able to partner and do community together.
Thank you so much for bringing in the family perspective there, Nicholas. We really appreciate you putting that all together so we could hear from families who have been fostering and doing such a great job. This concludes the speaking portion of our presentation. If our speakers just want to turn on their cameras and give us a wave, or we just want to thank all of you so much for coming today, and for the staff that helped to make this possible. Kate and Ashley on our event committee, and Chris, Michelle, and Francine on our interpretive services. So thank you so much for our speakers again. I will now be providing instructions for us to switch over to breakout rooms. So folks that are still on the call that are going to be participating in the breakout rooms, we will be providing instructions for that now.